Hi, my name is Kate. I'm one of the nurses here at the Center for Cosmetic Surgery.
Hi, my name is Rihanna and I'm a nurse as well.
And we're here to talk to you a little bit about post-op drains.
A drain is a thin plastic tube with holes at the end that is placed within an open space during surgery.
It's placed in order to remove any fluid that collects in the area after surgery. The end of the tube is outside of the body and has a bulb like this that collects the fluid. Tissues that are cut during surgeries tend to leak fluid. If they are not removed properly, then they can accumulate underneath the skin and cause problems.
3 principal reasons for having a drain are to allow the wound to heal, to reduce the chance of infection, and to reduce discomfort, which may be caused by increased pressure within the area. The JP drain, or Jackson-Pratt drain, removes fluid by creating suction with the bulb at the end.
The suction is created by negative pressure when it's squeezed flat to pull the fluid from the body into the bulb.
The bulb will expand as it fills with fluid. Over time, the amount of fluid collected in the bulb will decrease, and that's when the drain may be removed.
This will depend on individual circumstances as well as the surgery that you've had.
Drains are typically removed when the output is less than 30 milliliters in a 24-hour period, and the drain needs to be in place for at least 5 to 7 days, depending on your surgeon's preference. The color of the output also needs to be lightening up over time from a dark red to more of an orange hue. You need to be aware of any potential problems that may arise. In most cases, there are very few complications. Some of the complications could be the following.
Infections may occur anytime there is a drain in place. The infection can occur around the insertion site of the drain and may require antibiotics. Signs and symptoms of infection are redness, swelling, fluid leakage around the drain insertion site, as well as an increased temperature of 101.5 or more.
Although the purpose of the drain is to collect fluid underneath the surface of the skin, there is a chance that fluid may accumulate, which is called a seroma.
If there is a seroma or fluid collection, your doctor will need to remove this by replacing a drain or by another method.
You may feel discomfort around your drain site. If so, you may take Tylenol, ibuprofen, or your prescribed pain medication.
Your recovery nurse will discuss possible medication options that would work best for you.
You should measure the output of the drains at the same times every day. We suggest 8 a.m. and 8 p.m. Always wash your hands thoroughly before and after drain care.
In order to start emptying your drain, we will have you milk or strip the tubing. To do this, hold onto the drain near the insertion site, squeeze the tubing and pull gently to help break up any clots that may form in the tube.
To empty the bulb, you want to release the pressure by opening the cap. Once the cap is open, the bulb will inflate.
Using a medicine cup with graduated lines to measure the amount of output, empty the contents into the cup. Set it on a flat surface to measure accurately how much there is. We've provided a drain record for you to look at and record all of your drainage. After you've measured the contents of the output, you can either dump this into the toilet or the sink, rinse your cup, and then set it aside for your use later.
You'll then want to squeeze the bulb, replace the cap, and then secure the bulb onto your clothing or ACE wrap. A helpful tip for showering is to use either a lanyard or a shoelace. You'll then want to take the safety pin or clip and attach. When your drain is ready to be removed, the nurse will remove the dressing covering the drain site. There is a small stitch holding the drain in place. The nurse will remove that stitch and gently remove the drain. You may feel some discomfort, but generally this is very well tolerated.
While we encourage walking and daily activities, try to remember to keep your heart rate and blood pressure low while you have your drains in place in order to decrease the amount of fluid collection in the area. If you feel like you're having a problem with your drain, such as the drain loses suction or you're having excessive leakage around the drain site, please give us a call at the nurse hotline number, which is listed on your discharge paperwork, as well as the drain record.